I'm bored with MPs arguing over who does or doesn't have a cervix. An article by me, Ugla Stefanía Kristjönudóttir Jónsdóttir, in my Metro column. Every morning I wake up worried about what rubbish I'm going to read in the news about trans people like me. One of the biggest stories last week was an argument about who does or does not have a cervix. Labour leader Keir Starmer said it wasn't right to say that only women have cervixes in response to Labour MP Rosie Duffield's previous comments, which Health Secretary Sajid Javid said on Twitter was a total denial of scientific fact. I watched with despair as this argument unfolded, where trans people were yet again forced to remind politicians and the general public that we do indeed exist. As Health Secretary, it's inappropriate and incorrect for Javid to make such a statement. Trans men, non-binary people and some intersex people do have cervixes and they are not women. Furthermore, some intersex women, trans women and cisgender women who have had a full hysterectomy do not have one. These are facts in a social understanding and in legal terms and are acknowledged by major scientific bodies around the world, such as the World Organization of Health, who have stated that transgender health issues will no longer be classified as mental or behavioral disorders. A trans man on hormone therapy who has legally changed their ID to male is not a woman in a social or a legal context, even if they have had bottom surgery on their genitals or reproductive organs. They are a man, recognized in law, who has a cervix. The fact that the Health Secretary does not recognize this suggests either prejudice or ignorance, neither of which is suited for a person in his position. On top of that, we had Equalities Minister Liz Truss say that trans people shouldn't be able to self-identify, a term that has often been used by those fighting against equal rights for trans people to suggest that better access to legal gender recognition is a frivolous and a careless thing, and is meant to incite fear about trans rights. In reality, it's a simplified proposed legal process, which involves a statutory declaration that allows you to change your gender on your ID documents without having to be diagnosed by a medical professional as of having gender dysphoria. It's frustrating to see our Equalities Minister be against such an important change for trans people, as many countries in Europe and beyond, such as Ireland, Iceland, Denmark, Norway, Malta, Portugal, Luxembourg, Greece, Costa Rica, Mexico, Brazil, Colombia, Ecuador, Uruguay and Argentina have already adopted a model where trans people can legally change their gender without a diagnosis. In my view, for Truss to say that the government has taken the right approach isn't the case, and is contradictory to their proposal from 2016 where they wanted to reform the Gender Recognition Act. They have not taken an approach at all since 2004, when the Gender Recognition Act was passed, and the UK is steadily falling behind other countries in Europe in terms of trans rights and equality. It's humiliating to have to be evaluated by complete strangers and prove to them who you are. A simplified legal process is perfectly suitable to allow people to access legal gender recognition. The issue of who does or does not have a cervix is irrelevant, and the constant back and forth about self-ID only serves as a diversion from the real problems facing the UK's trans population. It's mind-numbingly frustrating that arguments about cervixes and self-ID become a media frenzy, instead of journalists and politicians focusing on the ongoing crisis within the NHS in terms of trans-related healthcare. Waiting times for a single appointment at both the Tavistock Portman NHS Foundation Trust and the Gender Identity Clinic have increased exponentially in the last few years, and they only seem to be getting longer. At the start of this year, according to the Care Quality Commission, 26% of young people are waiting for up to 2 years to get an appointment at the Tavistock, with 2/3 waiting up to a year. According to the GIC's official website, there are currently 9,667 people on their waiting list, and they are currently seeing patients who were referred to them in 2017. That's 4 years people have been waiting for a single appointment. 4 years. Even after that, there is often another long interlude before trans people can access hormones and surgeries, making the current waiting time for actual treatment even lengthier. Not only is this delay completely unacceptable, but it is literally in breach of law. As a patient, you have the right to access treatment within the maximum limit from your GP referral, which is listed as 18 weeks in the handbook to the NHS Constitution for England. It explicitly states that if you do not receive treatment within that time frame, then the NHS has to take all reasonable steps to offer you a range of suitable alternative providers if this is not possible. Trans people getting their appointment from a referral in 2017 have been waiting for over 200 weeks. But that's not all. Earlier this year, all bottom surgeries for trans men and non-binary people have not been available due to the NHS failing to secure a contract with a service that can provide these procedures. Trans men and non-binary people now have no time frame of when they can access surgery. Certain surgical changes are also given in several stages due to their complexity, meaning that those that have already undergone initial treatment are left in limbo, not knowing when all the stages of their surgery will be completed. It's quite obvious that there is a crisis going on, and that trans people are not receiving the adequate healthcare within acceptable periods of time, and nor are they being given options to get the medical attention they need elsewhere on the NHS or via alternative services. This can force trans people to seek going private as their only option, which can put many of them into debt trying to afford it. Countless fundraising requests have been circulating on social media for years, where trans people are asking for help to afford hormones or surgeries that the NHS has failed to provide. It doesn't take a healthcare professional to realise that waiting lists this long and no access to surgeries you desperately need are going to have severe impact on your mental and physical well-being. It's clear that something needs to change. In my mind, the NHS has failed us and is unable to provide trans people with the services they need under our current GIC framework, which forces trans people to seek specialist care and wait years. If you ask me, the only way forward in order to free trans people from the constraints of gender stereotypes is to implement an informed consent model without a diagnosis of any kind. This approach is supported by major bodies such as the World Organization of Health, in the ICD-11, and the World Professional Association of Transgender Health. This means that trans people would finally be in charge of what healthcare that they require. In the UK, this could be done under primary care by a GP, effectively cutting waiting lists indefinitely. The duty of healthcare professionals would simply be to inform their patients of what certain treatments would involve and refer them to the appropriate surgeons or other doctors. I believe allowing trans people to be in charge of their own healthcare is the only way they will achieve true liberation. Our current model restricts the freedom and liberties of trans people to choose their own fate and forces us to be judged by standards and gender expectations that no one else is. Cervix or not, we deserve to be in charge of our own lives. If trans people are to be equal in the UK, we need to transform our healthcare model to one that prioritises safety and compassion, one of informed consent under primary care. These are issues our politicians like Javid and Truss should be focusing on if they truly care about transgender people in this country, instead of making facetious statements about cervixes or self-ID. Otherwise, trans people will continue to suffer needlessly because our government and healthcare system insists on keeping us waiting rather than making meaningful progress.